Okay, so the next we're going to be looking at is genital herpes. Okay, genital herpes. Now, in this particular case, you're an FY2 in a GP surgery. This is a young lady who was presented with an embarrassing problem. Okay, a young lady has presented an embarrassing problem. So when you ask in there, how can I help you? Doctor, I've got an embarrassing problem. Now, this particular concern, it's important that you address it properly. When the patient says I've got an embarrassing problem, most people think it's about offering confidentiality. It's not necessarily confidentiality, but you have to just reassure them that we are professionals. We do see different patients with different, or we see different people with different problems. We are used to seeing, or discussing or helping people with their own personal problems. So we are professionals. We are used to it. We are used to this, and we see many, many patients with similar problems. So there is nothing to be embarrassed about. That should be your approach. Okay, good. Now, this particular case, what is important is you have to take the history properly. The patient is 28 weeks pregnant, and she's worried whether that can affect the baby. Okay, she's worried if it will affect the baby. Okay, will this going to affect the baby? That's her main concern. So she has got rashes in her genital area, and she's also asking, is my husband cheating on me? Okay, is my husband cheating on me? So you have to answer that particular question, yeah, for this patient. Of course, it's not your position to comment about the relationship, okay? But our main problem is, doctor, I've got an embarrassing problem. When you ask what personal problem you have, you tell she has got rashes. The rashes appeared 2 days ago. Okay, there are multiple rashes in the genital area, and they are painful. She's 28 weeks pregnant. She also has got a burning sensation when passing urine. Okay, so will it affect my baby? Is my husband cheating on me? Then you take a history. Ask about the onset and duration of the symptoms. What's the problem? I've got rashes. So we're going to be asking, so where is the rash? The rash is on my private part. I've got rashes down there. So can you tell me what you mean about down there? Do you mean your genital area? Yes. Using medical terms, sometimes it's better. Yes, my genital area. So when did the rash appear? 2 days ago. Is it one rash? Is it multiple rashes? Multiple rashes. Are there any ulcers? Actually, yes. Now that you have asked, it could be some ulcers. Is it itchy? Okay. Well, it's kind of painful. It's a burning kind of. Okay. So there is pain, not necessarily itchy. Okay. So you need to ask if there is ulcers. Yes, there is ulcers. Otherwise, the patient is not going to create a rash. In the beginning, it is important to ask, yes, there is a rash. When did the rash appear? Is it one rash? Is it multiple rashes? Is it itchy? Is it painful? Any bleeding? You're going to be asking. Now, other than the ulcers or the rashes, is there any other symptoms, such as, burning sensation passing urine? Yes, this particular patient has. Is there any vaginal discharge? No. Any fever? I didn't measure the temperature. Do you have any other similar symptoms? You know what genital herpes can do? Can cause headaches, can cause running nose, can cause sneezing. So ask about headache, running nose, sneezing, or any flu-like symptoms recently. Okay. Is this the first time it has appeared? Recurrent genital herpes, is it treated differently from first episode? Okay. Now, any previous cold sores, either in herself or in the partner. A sexual history is crucial in here. Okay. Ask about how long is she in a stable relationship, how long she has been with a partner, any new partner recently or change of sexual partner recently. Okay. Any more than one sexual partner in the last 1 year is significant in this case. Okay, so I want to ask about the current and the previous partners. In the last 1 year, how many partners have you had? Do you practice self-sex? Do you use condoms? Okay, then you finish the rest of the history, the PMAFTOSA, the ice, the effects of symptoms. It is difficult because of the pain all the time. Okay, then you have to do examination. You check the observations and, of course, the inspection of your private area, which you need to inspection. Now they'll give you a picture, and this is the picture that will be given to you. You can see multiple ulcers in here is what you can see. Yeah, but they are, of course, the superficial multiple ulcers that are actually painful. Then you explain the diagnosis. You have already looked at, she has got genital herpes. It's a viral infection. Okay, it's a viral infection, but it is a sexually transmitted infection. So genital herpes is caused by viruses. It is a sexually transmitted infection. treatment, because it's sexually transmitted infection, she needs to go to gum clinic. And remember, if the patient does not want to go to gum clinic, they can always be managed in a GP surgery. Explain what the gum clinic will do. They'll take some swab from the lesions. Okay, they'll screen for other sexually transmitted infections as well, like gonorrhea, chlamydia, and you'll be prescribed what oral aciclovir. The gum clinic, they're the specialist in this area. Now, this patient is 28 weeks pregnant. So usually this can affect your baby because the baby can get infected during delivery. So usually they would give you aciclovir to take continuously until delivery. And sometimes the specialist may suggest a cesarean section. So what we're going to do, we'll refer you to the obstetrician as well. We need to take their opinion regarding this, and they can discuss, okay? Because sometimes they may suggest a cesarean section to avoid the baby acquiring the infection during delivery, okay? And aciclovir, of course, to be taken daily until delivery is a usual standard. But the specialist, again, will assess, will review, will confirm the treatment for you. Give advice. So we're going to get advice from the obstetrician on how to manage this case because they may suggest a C-section. Advise to clean the affected area with plain or salt water to help prevent secondary infection, and this will promote the healing. Advise to apply Vaseline or topical anesthetics for the pain. Okay, increase fluid intake so that the urine is dilute, because the more concentrated the urine is, the more painful it would be when urinating. Okay, avoid wearing. So you need to avoid wearing tight clothing. Okay, so this is the advice from us. Yeah, so let me just go here and just remove this. We are advising the patient. We will take the advice from the obstetrician because, okay, because she's 28 weeks pregnant and they may suggest what? A cesarean section. But the rest of us, the rest of the information is us advising the patient, me as a GP advising the patient that you need to avoid wearing tight clothing or tight underwear to avoid irritation. Take adequate analgesia like paracetamol, yeah, adequate pain relief. Avoid sharing towels, okay, because this infection can be passed to others. Advise to abstain from sexual intercourse, okay, because again, you can pass it to the husband. When you check the history, you'll find that the husband does not have any symptoms. Advise also to abstain any kind of sexual intercourse or any kind of intercourse, including non-penetrative sexual intercourse like oral genital sex, until there's a follow-up, until the lesions have healed, Okay, so this is genital herpes. Thank you. So to recap your management, this particular patient, we need to refer to the gynae. Okay, the gum clinic will take some swab, screen for other STIs. Okay, we usually offer aciclovir because she's 28 weeks pregnant. She might need to take it, until delivery. If they are less than 28 weeks, usually it's only 5 days treatment. But because she's 28 weeks onwards, this is why might need treatment all the way into delivery, and they might suggest cesarean section because usually a baby is affected during delivery. So to avoid that, they may suggest a cesarean section. And we're gonna give her advice. We're gonna take advice from obstetrician, okay? But then we're gonna advise this patient again to clean the area with plain water or salt water to prevent bacteria infection. Apply Vaseline or topical anesthetics that will help with the pain. Increase the fluid intake that will help to have dilute urine and not concentrated urine that may irritate the lesion more. Take adequate analgesia. Avoid sharing of the towels. Do not avoid wearing tight underwear or tight clothes. Okay, and to abstain from sexual intercourse, including non-penetrative sexual intercourse, until the lesions have healed. Thank you.